One question that I get asked a lot is, what squat should I be doing if I have back pain? What's the best squat variation for back pain? Today we're gonna dig deep into that. What's up, everybody? My name's Dr. Michael Mash, and welcome to this week's episode of Whiteboard Wednesday. Before we get started, please subscribe to this channel if you find this information interesting. Subscribing helps us reach a larger audience, and we depend on you guys for that. So thanks for watching. Today we're going to talk about which squat variation is best for low back pain. Is it the high bar squat, the goblet squat, low bar, front squat, safety bar? There's so many different squat variation. There has to be some variation that is best for low back pain. Well, turns out there isn't. That's the end of the video. Just kidding. Well, here's the deal. When it comes to different squat variations and when it comes to back pain, everybody's different. I know, here we go. Another one of those it depends videos. How do you fix it? It depends. It depends. When it really comes down to it, it does depend because everybody's back pain is going to be different. It goes on this idea that, well, low bar squats are worst for the back because of the increased torso angle. So if somebody has back pain, you shouldn't do low bar squats. Not always. On the flip side, people will say, oh, well, if you have back pain, the front squat is the best variation because it's the most upright and theoretically it's the least amount of stress due to the decreased moment arm on the low back. Again, biomechanically, yes, but pain's weird. That's the thing. Take it, for example, if somebody tweaked their back or hurt their back doing front squats, and now they have a fear avoidance of front squats, is a front squat for that person the best for their back pain right now? Probably not. Maybe doing a low bar squat, getting them into a pattern that they didn't hurt themselves on temporarily, maybe a low bar squat would be beneficial in that case. You got to play around with different variations, especially if you're dealing with back pain, to see which one works best for you. Did you hurt yourself doing high bar squats? Can you still do a high bar squat with decreased load? No. Then maybe high bar squats aren't good for you right now. Try a safety bar, try a low bar. The whole thing is you have these options, and you can't really, when it comes to back pain, you can't really go by biomechanics because it may deal with, okay, is the person sensitized in extension or are they sensitized in flexion? Or neither. Does their back hurt regardless of what position? So if somebody's sensitized in flexion, that means that it hurts to bend forward. A front squat may not be the best squat to do right now because with heavier loads, it's going to encourage more flexion. In that case, maybe a low bar squat will be better. There's no right answer. Unfortunately, I wish I had a system for you. If you tweak your back, then you should do this squat variation, but you got to really see what works for that person. This is what really comes down to the clinical aspect of treating low back pain. And you have to have some sort of which ranges of motion are sensitized. What does the client or what do you think is going on? Does the person erroneously think their back's out so that they're afraid to do anything to make it worse? Do they have fear avoidance of movement? What can they do? How can you move in order to promote self-efficacy, in order to reduce fear of movement? Which variation is going to allow that person in front of you to do that? So I think the big myth that I want to dispel is that there's some biomechanical explanation of why one squat would be better. The low bar squat is demonized for people with low back pain because, oh my, that pitched forward torso is going to wreck you. For me personally, again, this is N of 1, this is just me. When I tweaked my back, the low bar squat is what felt best for me. I couldn't even dare think about doing a front squat. It may be the complete opposite for somebody else. Find a squat variation, find a load, find a rep scheme that feels good to the person in front of you, and that's what you got to go with. Low back pain's weird. Pain in general is weird. You can't really single it down to this variation is best for back pain. You got to experiment. I hope you enjoyed this video. Again, if you'd like, please subscribe to this channel. And thank you for watching this week's Whiteboard Wednesday. I'll see you next week.